Jonathan, before I go into some of the concerns that we have in relation to the rollout, of course, it is duty bound on us to congratulate the government, of course, the British government, the Ministry of Defence, all the nurses that are delivering the jabs into people's arms so that we can get as much coverage of the vaccination to our community as possible, to our elderly and to our old people and the rest of our community. And now with the hope of the second jab, that we can now receive full immunity from this terrible virus and the clear loss of life that we've endured and the pain and suffering to many people in our community. But insofar as the concerns about the vaccination programme, we've heard stories amongst the community and reports being received that the priority may not be quite as it has been illustrated previously. And therefore, I think we're asking the government to expand on how it is delivering the first jab into the arms of people and now how they're going to roll out the second programme, which we understand from last night will be delivered, will be started at least at the end of this weekend. So I think it's important that people have that reassurance. I know the website sets out who is prioritised, but we're hearing a number of issues regarding who should be on that list, and people may be being escalated above that list. It may be for innocent reasons, of course, and I can't say that anything it's some bad faith, that anything's going wrong here, but it would be important for the government to clarify how we're going to complete this process amongst the rest of the population and how it will be followed through to the second jab.
You've described reports of inconsistencies in the approach that the vaccine procedure has developed. Can you explain what you mean by these inconsistencies? Can you be a little bit more specific?
Well, I think the inconsistencies are in relation to the types of individuals that may well be not engaging in public countering, for example. So if an offer has been made to a group of people within the civil service, there must be a rationale for delivering of vaccines to that particular group. I should say that yesterday, the members of parliament on our side were offered the vaccine. And those that are not in risk categories said, well, I don't think we should, and I certainly said, I don't think we should be vaccinated until our priority, whatever that priority is, comes to fruition. So at this stage, I'm slightly confused as to the approach the government's adopted.
These decisions are being made by health professionals and public health officials. Are you questioning their judgment?
Well, what I'm asking for, the government has set up a website where it sets out a list of priorities in respect of those that have vulnerabilities in categories between 60 and 65 with vulnerabilities, and then category 8, I believe, is the rest of the population. We are hearing not complaints, but issues from members of the public as to certain groups being offered a vaccine who might not necessarily fall within those, those priorities. So what we're just doing is asking for clarification as to who is being offered the vaccine and when the government expects to complete the rollout of vaccination jab 1. So that's all we're doing. We're asking for clarification because the public, I believe, have a right to know who will be vaccinated and who isn't at this stage.